In this video, we're going to cover the 6 key questions that you should be trying to answer in your medical personal statement. It's really important that you address these because these are the things that we as admissions tutors are looking for and asking ourselves when we read through a personal statement. You'll be surprised how often these key fundamental questions are not addressed in the personal statement, and as such it makes it that much more difficult for us to give an interview, and even in the interview to then ask relevant questions based on the personal statement. So I cannot emphasize enough how much you must make sure at least these 6 areas are covered. Now, of course, this just is the bare minimum of what is required from a medical personal statement. In future videos, we will go through each of these key points in turn and give you examples of how to answer it well, and also importantly, when it's not been answered well, and examples of how students have previously answered it where it's not been as impactful. Probably the most fundamental point that you have to bring across in your personal statement is, why do you want to study medicine? It may seem really simple and obvious to write that, but you'll be surprised how often people write a personal statement and by the end of it, we as admissions tutors have no idea why they actually want to study medicine. Now, sometimes that's because what they've focused on is on one particular part of medicine, for example the sciences, and not mentioned anything about clinical care and about patients and about caring for people. And we will ask ourselves, well, okay, yes, they really enjoy the science of medicine, but then why not study biomedical sciences? On the converse, sometimes we have people who focus purely on caring for people and helping people, and then we turn around and say, well, okay, well, if that's the case, why don't you want to be a fireman? Or why don't you want to be a nurse or a physio? What is it about a doctor specifically that draws you to them? Now, we'll go through, like I say in other videos, good answers for this. And sometimes in the interview itself, we will ask, why do you want to be a doctor? Often that question is asked if it's not entirely clear in the personal statement. So really, you should try to address this in the personal statement if you can. Be clear, and the most important thing is give a personal reason. Be specific and give examples. It's no good just saying that you want to be a doctor because you enjoy sciences and learning about science. Give examples of where you've enjoyed learning about science, where you've gone above and beyond the level of the curriculum, and you've read extra articles, for example, an article in Scientific American, or you've written an essay for an essay competition on the future of medicine or medical technologies, or in this current climate, talking about medical innovations and how doctors have tried to innovate to try and keep patients safe when they've had such a big influx of new patients coming in with critically unwell symptoms. So always make sure you try and emphasize why you want to study medicine. Alongside that, it's really important for us as admissions tutors to actually see that you understand what it entails to study medicine. And this is studying medicine not just at medical school, but also after medical school, when you become a doctor. Because learning never really stops as a doctor. You're always learning about new techniques, new research comes out, and new medications come out. And so part of your core set of abilities should be to continually develop yourself and continually learn new information. When considering medical school, you have to be able to show the admissions tutors that you understand that medical school is tough. It requires you to go into university every single day, often coming in on weekends and doing extra shifts here and there to try and get more experience. That it is very much a self-guided course. Of course, there'll be a lot of structure to helping you to learn the different subjects, but a lot of it is down to you as the individual going away and reading about topics and reading around topics. And that's why having those additional parts in the personal statement, where you talk about additional work that you've done, additional exams that you've taken, papers and journals that you read outside of your core curriculum. That's why we look for those things, because it shows that you've got an inquisitive mind and an ability to teach yourself and to study by yourself. You don't need everything to be spoon-fed to you, and that is really important in university. Similarly, it shows intellectual curiosity. It shows that you're always willing to look for new things and to study and to push your knowledge further forward, which is vital to being able to be a good doctor and to keep yourself apprised of all the new clinical advances. I cannot emphasize enough how often people forget to talk about the fact that you care about people, that you're doing medicine because you want to help people. Lots of people focus on the science. They talk about the interesting papers that they've read. They talk about the interesting things that they saw on work experience, for example, with different treatments and surgeries. But they totally forget about focusing on the patient. And like I said with the first point, why you want to be a doctor. The point of being a doctor is that you take that clinical knowledge and then you apply it to the patient. You show care and compassion for your patients. The best way to do this is by taking in what you saw on work experience and talking about those times where you saw healthcare professionals care for people and empathise with patients and be there for their patients. Similarly, it's really important to talk about times where you've taken time out of your own life to help other people. And that's where the things like volunteering and teaching come in really important in your personal statement. Because what you're trying to do is show us as the admissions tutors that you have that natural urge and inclination towards helping people, applying your knowledge and your time to making other people's lives better. So always think to yourself, when you've written your personal statement, have you given specific targeted examples of where you have tried to help people and where you have noticed how doctors and nurses have helped patients during your work experience placements. Along the same theme as the last few points, you must show that you are willing to go above and beyond to better yourself. This is where those additional qualifications come in, so doing things like biology Olympiads, doing things like additional step papers or doing additional A-levels. It's so important to show that you're able to take on board extra things and to be able to manage your time and to be organised enough to do that, but also to have the drive to be able to push yourself forward and to develop yourself. Because the key thing as a doctor and as a medical student is that you help develop yourself the whole time, that you go above and beyond the basics of what the course provides. At university, it is not about just passing an exam. It is about developing your skills and developing yourself to the point where you will be able to function as a doctor. And a lot of that is about being self-directed. And make sure that you give examples of that. So give the examples of where you've worked beyond the curriculum. For example, there was an excellent personal statement where someone had written about the fact that they'd learnt about gene research in their International Baccalaureate IB studies. And what they did then was they went away and they read about it and they studied it, and then they applied to a summer internship at a lab where they did gene research. And so then they worked with postdoctoral students and did some work on gene research. And then they specifically looked at its application clinically when looking at gene therapy in certain genetic conditions like cystic fibrosis. So you can see there's a whole progression there, that the person has learned about a topic in their IB studies. They've then gone on to read up more about it. And the real step, the thing that makes it really interesting, is the fact that they then contacted a lab and went and worked and studied. And then the most important thing is they then saw the clinical application of it. And so it wasn't just that they were interested in the science, but they were then interested in applying it to the patient. And that's what being a doctor is. It's about taking the science and applying it to the patient. So you can see how that simple example shows that you're going above and beyond to try and better yourself and to develop your skills to be a good doctor. Teamwork is the name of the game. In medicine, we don't do anything on our own. Every single thing that we do for a patient is usually in collaboration with multiple other people. If you take, for example, surgery, the surgery can't go ahead without the surgical nurses being there, without the radiology team being able to diagnose what needs to be taken out, without the anaesthetist being there to put the patient off to sleep, to keep them safe during the surgery, and to make them comfortable after the surgery. Without the intensive care team there to look after the patient after surgery if they become unwell. So you can see that teamwork is vital to being a good doctor. And so when you're writing a personal statement, think about where you can show evidence of teamwork. People put things like that they play rugby or cricket or any of those other team sports, but they don't actually say why that's important or relevant to your application. And the importance of it is that it shows that you can work as part of a team. And being a doctor is not just about being a leader in every situation, it's also about being a good follower, being able to work as part of a team towards a common goal, which is the patient getting better. So make sure you have specific examples of where you've worked in a team, but also apply that. So then say, for example, I really enjoyed playing cricket for the first 11. It was a fantastic team that we grew up together, and we spent the 4 or 5 years playing together. We achieved the nationals 3 or 4 times, and you saw how important teamwork was, and you've developed those teamwork skills because on your work experience you saw how intricately the doctors and the nurses and the physios worked together to get a patient who had just had surgery on their leg up and walking and then out of hospital. So you can see how you join up your experiences with what you've seen in your work experience and therefore applied it to being a doctor. Alongside teamwork, the other important thing is to be able to communicate effectively. You must be able to talk to people, share a mental model, explain what's going on, not just to the patient, but also to the rest of the medical team, be that other doctors, nurses, physios, or all the other people who work within a hospital. So to show that you can communicate effectively is really important in your personal statement. And again, when thinking about examples and things to write about yourself, make sure you put something in about your ability to communicate. That can be something as simple as saying that you do drama and therefore you have to act and you have to communicate and you have to speak clearly. Or it might be something like working as part of a cricket team or a rugby team where you have to communicate with your team members to be able to do certain plays and to be able to make sure that you win or you contain the game in such a way that you can move forward later. So communication is really important, and having clear and concrete examples of that, not just in the clinical setting, which you can say that you've observed when you've done the work experience, but also in your own personal experience, whether that's in teams, in extracurricular activities, or just on a day-to-day basis. And don't forget that communication isn't just verbal. You can also think about written communication. So this is why we're so impressed when people do things like writing articles for school newspapers or for local newspapers or writing letters that get published, because it shows that you're able to communicate clearly and effectively, and that is vital to being a doctor. Some people ask, well, why do we need to do all these extracurricular activities if you're going to be a doctor? And actually, to be honest with you, the extracurricular activity itself doesn't really matter. What we are trying to see, however, is that people are able to fit things in around their schoolwork. That schoolwork isn't the number one thing that they do, and that they are able to do other things, pursue other interests, because that always requires a level of organisation. It requires people to be able to manage their time appropriately so that they can do those additional things while still being able to achieve good grades academically. And you must try and show evidence of where you've been organised. And you can do that as simply as saying, I've had to really develop my organisational skills because in addition to my schoolwork, I've also represented the school at multiple sports and also done other extracurricular things outside of school such as drama or orchestra. And so in order to fit all of those things with all the challenges on my time, I've had to be really organised. So you can see how automatically we're thinking, yes, well, this student's going to be able to cope with medical school, where you have to organise yourself. Not everything is going to be spoon-fed to you, and you're going to be able to continue doing other extracurricular activities without getting overwhelmed by the increased workload that university has. So these are the core basic things that every medical personal statement must have. You have to address each of these points, and when you read through your personal statement, you must ask yourself, did I give a good example of that, and did I give a specific example? And this final point that you see here, personalizing your response, is probably the most important. You must make sure you keep the examples personalized. Don't give generic examples. Instead, try and make it as clear as possible that it's your lived experience, because it just means that it's much more impactful to the listener or to the reader that it's actually you who's done it, as opposed to it just being a generic statement. Now, in the next series of videos, you're going to see a huge amount looking at each of these specific points in turn, giving examples of good answers and also ones that have not been so good. And also giving you some examples of things for you to think about doing if you're earlier on in the application process and you've got time to sort of look at doing extracurricular activities that address these specific points to showcase these skills that we're looking for in the personal statement.